Chairman, members of the committee, Joe Castley, State Attorney for Harford County, speaking on House Bill 879 in opposition. I'm going to be very brief and to the point. This is a bill on decriminalization, and I would simply like to raise a couple of issues. One is the question was brought up earlier about the effect of marijuana in the treatment system. According to the Substance Abuse and Mental Health Administration, admissions for treatment admissions for marijuana are second only to treatment admissions for alcohol. So it is the second highest drug treatment admission. Decriminalization, I believe, will have three effects in Maryland. One is already been discussed, the use of marijuana, odor of marijuana as a probable cause basis. But the other two will be, one, you probably can eliminate drug courts in the state of Maryland once there is no longer a criminal incentive to hang over someone's head as a compulsion to go to treatment. I don't think you're going to find people voluntarily admitting themselves to drug treatment any longer. But finally, I think that the other issue that has not been raised before is the effect, the ability of prosecutors to use misdemeanors to be able to screen misdemeanors or allow pleas for felonies down to misdemeanors. Currently, I screened charges that are charged as felony distribution or possession with intent to distribute felonies. On first-time offenders on low-level amounts, I am screening them down to be charged as misdemeanors. Also, on some cases where they are still charged as felonies, but where the defendant has a very good record, we are allowing them to plead down to misdemeanors. If you decriminalize marijuana possession, you will eliminate an option for prosecutors to allow pleas to misdemeanors, and you will end up with additional felony convictions on cases that might have been pled down to misdemeanors. Finally, since Delegate Mazur referenced the Senate bill and said that in the answer to Delegate McComas' question about subsequent offenders, I did have a copy of the Senate bill, which provides, interestingly, for second violation and third violations. And my question is, if it's a civil offense and it's a civil offense to avoid a criminal record, who's going to know if it's your second or third violation? And if it's your third violation, you can be ordered into drug treatment. But again, if it's still a civil violation, how are you going to end up in front of a court or a judge who's going to pass this order to order you into drug treatment? I think that what you're finding is, and what the testimony of the prosecutors was earlier is, there has already been de facto decriminalization. We are already in the first, second, third instance of drug possession, putting people into treatment programs, educational programs, and counseling programs. If you decriminalize marijuana and eliminate possession, all that will go away. And I think that will be a bad thing. Thank you.
Good afternoon, or I guess it is good evening. My name is Dr. Nancy Rosen-Cohen, and I'm the Executive Director of the Maryland affiliate of the National Council on Alcoholism and Drug Dependence. We are a statewide organization that advocates for individuals and families who are affected by alcoholism and drug addiction. NCADD Maryland strongly supports House Bill 879. Criminal records are one of the most significant barriers people have in accessing employment and housing. For people in recovery, the lack of stable housing and employment can also threaten their recovery. While not everyone who's arrested for possession of a small amount of marijuana has a substance use disorder, those who do are not well served in prison. There's very little treatment available to people who are incarcerated in Maryland. Those who are in long-term recovery can have marijuana possession convictions impede their ability to find a job for many years after the convictions and many years after they've started their journey to recovery. Given the racial disparities that you heard earlier made clear in the ACLU's report, this obviously becomes a much more serious issue for African American families. NCADD also believes that the money spent on enforcing marijuana possession laws in Maryland would go a long way toward providing an adequate continuum of services for people with substance use disorder. A portion of the $100 million spent on enforcing marijuana possession laws could be used for prevention and intervention in schools, desperately needed treatment services for our youth, and outreach to people with co-occurring mental health and substance use disorders. Instead, we have seen a reduction in state dollars for treatment services in the proposed budget. We urge your support of House Bill 879 to end this needless waste of money and human capital. Thank you.
Mr. Chairman and Committee, my name is John Winslow. I'm the President of the Maryland Addiction Directors Council. I'm the Director of the Dorchester County Addictions Program. I also happen to be a person in long-term recovery, which for me means that I'm in my 38th year of continuous sobriety. There has been so much information that has been presented before you this afternoon and now into this evening, and there have been so many arguments. This is obviously an extremely complex issue, and I don't think that there's any clear-cut right or wrong answers. However, I am here today to provide some verbal testimony in support of the written testimony provided in support of House Bill 879. We are not in support of House Bill 880. And 879 with amendments regarding the decriminalization of possession and use of small amounts of marijuana. So I'm going to be relatively brief, or as brief as I can. As a seasoned treatment provider and a person in long-term recovery for many years, I have long witnessed the seemingly never-ending negative consequences for those that have been arrested or found guilty for possession and or use of small amounts of marijuana. What many people fail to realize is that our communities and our society also pay a very heavy price for these consequences as well. As you're all aware, our prisons, our jails, our entire criminal justice networks are bursting at the seams with such cases, as a lot of testimony you've heard today. The cost to individuals, communities, and our society as a whole is almost incomprehensible, and it's shameful, especially in regard to the racial disparities that has been mentioned time and time again today. Who among us can any longer deny that the war on drugs is not working and is never going to work? Along those lines, I would urge anyone who has not yet seen the award-winning documentary, The House I Live In, to please watch this extremely informative film. It's available free on streaming on Netflix, and it highlights and reinforced our failed policies on illicit drugs. Passage of this bill to decriminalize, not to legalize possession and use of small amounts of marijuana is a big step in the direction of getting on the right path towards sensible drug laws. I would note that MADC supports policies that promote and fund interventions and treatment for substance use disorder related to marijuana use, and we do view marijuana as a public health issue. Thank you for your time.
Good evening, Mr. Chairman and panel. My name's Leo Domowski. I'm the Libertarian candidate for Attorney General of Maryland by night. During the day, I'm a hearing officer with the Maryland Parole Commission,